my name is Jacie. In April of 2022, I was diagnosed with chronic inflammatory response syndrome, also known as CIRS, biotoxin illness, or mold illness. I myself am not a provider, but I am an experienced patient, and I've done a lot of research. Today, I want to share with you how I was diagnosed and found a CIRS provider, and share resources that you can use to get diagnosed and find a provider for yourself if you think you may have CIRS. So CIRS happens when someone who is genetically predisposed to being really bad at eliminating a biotoxin encounters that biotoxin. The CIRS treatment protocol is geared towards helping patients eliminate the biotoxin and then treat the downstream impact that CIRS had on their immune system. To eliminate the biotoxins, you do need to take a binder. Personally, I follow the Shoemaker protocol. It's the only clinically proven path to healing from CIRS. The binders used on this protocol are really specific. They're specifically charged and they have a specific receptor cell site so that they can grab onto the biotoxins and help you eliminate them. These binders were actually accidentally discovered by Dr. Richie Shoemaker when there was an outbreak of algae in the bay of the small town that he was a family practitioner in. He had patients with just a crazy amount of symptoms, and he ended up treating this one lady for secretory diarrhea with an old school cholesterol med, hoping it would constipate her, and it helped all of her symptoms. So he was like, what the heck? And that's what led to the clinical trials we have today. I wanted to share a little bit about my backstory with CIRS so I could tell you how I was diagnosed and found CIRS and all of that to give you context for the resources I'm going to share ahead. In October of 2021, I started having really weird symptoms. If I'm honest, it actually started in June of 2021. That was when I had my first uveitis flare. Uveitis is inflammation of the middle of the eye. It went away pretty immediately, and then I didn't have any other symptoms until the end of July 2021 when I started having plantar fasciitis. Following that, in October, I had another uveitis flare. This one was catastrophic. I'll go ahead and put a picture here, but I ended up having syncytius, I think it's called, but it's where your pupil actually sticks to your cornea, and so you get this weird amoeba-shaped pupil. But it was catastrophic. I couldn't see out of this eye. There was so much inflammatory buildup in the middle of my eye. I couldn't see. It was very painful, sucked. Then I had some major GI issues, like sudden urgent need to go every 30 minutes. It would wake me up at night as well. So at that point, I went to an eye doctor for the uveitis, and they started testing me for HLA-B27, which is a haplotype that is associated with spondyloarthritis. People who have chronic uveitis, very often they have this HLA-B27 gene. At that point, I started getting enthesis or enthesitis, which is inflammation of tendons and ligaments, and this was very painful. I was walking with a cane. It was excruciating to move. I was spending like 10 minutes just laying in bed stiff, trying to psych myself up to roll over and get out of bed every morning. Eventually, I was diagnosed with ankylosing spondylitis, and gradually my symptoms started to improve while taking NSAIDs. I was kind of told by my rheumatologist and an eye doctor that this thing should settle over time, but the following year, in I think it was like March 2022, I still wasn't doing well. I had a meeting with my rheumatologist, and the medication that I thought was like my last ditch option turned out not to be an option for me. And I started questioning everything. I didn't want to live like that anymore. I couldn't fathom living in that much pain for the rest of my life. So I started having suicidal ideation. My mind was literally just trying to figure out a way to escape this extremely high level of pain that I was living in. And I want to normalize that. I think it's normal to, like, when your body is in that fight or flight response and you feel it's inescapable, I think it's normal to think of all avenues of escape. And by normalizing that, my hope is that more people will be like, oh, that's what my brain is trying to do. It's trying to think of an escape path. Clearly, I need to get help for this, and that is exactly what I did. So I ended up sharing a story on Instagram about how distraught I was after this rheumatologist appointment, and Nutrition with Judy reached out to me. Nutrition with Judy is an online nutritionist. Her full name is Judy Cho. Look her up. She's awesome. She wrote The Carnivore Cure. She reached out to me and she said, I think you might have this thing called CIRS. Now, when I first looked into CIRS, I was like, all this information seems really gaslighty. Like, it was so scientific and so dense that I felt like someone was trying to convince me of something. Anyways, I just had total CIRS brain. It felt really overwhelming. So I briefly looked into it, and then I was like, no, it's not me. I have this autoimmune condition. It has nothing to do with CIRS. Thankfully, Judy is Judy Cho, and she just has the biggest heart. She reached out to me again. She was like, no, really, I think this makes sense for you. So at that point, I trust Judy enough that I was like, okay, I'm going to look into this a little further. And that weekend, I ended up doing like 50 hours of research just trying to get a handle on what CIRS is. If you've looked for CIRS information on the internet, you'll know that it is very provider facing, difficult to understand. And for CIRS patients, when you have brain fog and it's hard to learn things, it's too hard. But I ended up doing some research. I became very convinced that CIRS was a very likely thing for me. And that's when I reached back out to Judy and said, okay, what are my next steps? So after I reached out to Judy, she helped me obtain the CIRS blood work. Half the blood work is for the genetic markers. The other half is for assessing the downstream impact of CIRS. I had the haplotypes that indicated I was susceptible to several different biotoxins. I had the mold one, the Gardasil vaccine one, the multi-susceptibility, chronic fatigue, and I think the Lyme vaccine one as well. And the blood markers for the downstream impacts clearly indicated that I had CIRS. At that point, Judy gave me an incredibly detailed breakdown of the blood work and my next steps. She actually gave me a list of providers to reach out to. So I called those provider offices and I went with the one I vibed with the most. I've been very happy with their treatment and level of care. Okay, enough about me. Let's talk about how you can find your diagnosis and get a CIRS provider. The diagnostic process for CIRS is really straightforward. There's a lot of gatekeeping to make sure you don't go on to the next step if you don't meet the parameters for the previous. For example, CIRS has 37 symptoms associated with it. They're arranged into symptom clusters. If you have a symptom in one of the clusters, it counts towards your total cluster count. And if you have 8 of the 13 symptom clusters, you very likely have CIRS. You can have less of the clusters and you may still want to do the blood work if CIRS seems like the right fit for you. But 8 out of 13, you probably have CIRS. Then you can also do the visual contrast sensitivity test. There's a site called VCSTest.com where you can do it for free or for $15 if you're wanting to support their initiative. Biotoxins impair nerve function, and the downstream impact of those biotoxins creates inflammatory effects, meaning that white blood cells will clog up the tiny capillaries in the back of your eye, and this makes it really difficult to see blurred lines. The visual contrast sensitivity test is a really great way to see what your biotoxin exposure is and possibly further confirm your diagnosis of CIRS. If you fail it, you very likely have CIRS. If you pass it, you could still have CIRS, especially if you're an artist or you have some sort of background in differentiating colors. It may not be a very reliable test for you. After the VCS test, it's time to get blood work. Like I said, there's 2 different sections to the blood work that you get. One is identifying the biotoxins you're susceptible to through your haplotypes, and the other half of the blood work is assessing the downstream impact of the inflammatory effects of the biotoxin. If you have the genetic haplotypes and enough of your blood work indicates you very likely have CIRS, at that point, it's time to find a CIRS provider. Now, if you go through the very amazing Nutrition with Judy for your blood work, she'll also send you a list of providers that either she has or her patients have worked with. It kind of gives you a cheat code of a provider list. But if you don't want to work with Nutrition with Judy, I don't know why you wouldn't. Sad life choice on your part. But you can go to survivingmold.com. All of the Shoemaker certified providers are listed there, and they have to submit an essay when they're certified talking about their treatment philosophies. You can see who you kind of vibe with. If you're looking for a provider that has a specialty like mast cell activation syndrome or Lyme disease, because that's your haplotype, then you can find those providers there. Finally, as someone who used to work in medical offices, I highly recommend calling the office. Call a few, get a vibe, get a sense of the front office staff. I can guarantee you if they are unhappy, you will be unhappy as a patient. Also, some providers offer consultations for like 15 minutes for a small fee or no fee, and that way you can see if that is a provider you can connect with well. You do have to be treated for like 12 to 18 months, so you want to find a provider who feels comfortable for you. My last piece of advice is if you end up seeing someone and you get a couple of appointments in and you're just not vibing with them, you're probably better off cutting your losses and finding a new provider than trying to make that relationship work. A huge part of the healing process is believing that you will heal, and a certain amount of trust in your provider is necessary for that to happen. Advocate for yourself, ask questions, take notes, record your meetings. We know CIRS brain is a thing. Your brain just feels like you're thinking through mud. So make sure that you are advocating for yourself as a patient and getting the information that you need. When I was diagnosed with CIRS, it was at the same time as my best friend Barbara, and we were just so grateful to have each other to lean on for support that we created the CIRSgroup.com. It's a supportive community of people who are healing from CIRS. We share our journeys on there, support each other, and we even share our experiences with our CIRS providers. So if you're looking for additional resources or just want the emotional support, come join us over at the CIRSgroup.com. If you or someone you love is healing from CIRS, I just wish you so much love and peace and healing through this entire process. Thank you so much for watching today, and I'll see you all in the next one. Okay, bye.